my name is Yunita Evy from Polytechnic Catholic Mangunjaya Semarang. Okay, I give a little understanding of what is COVID-19 and what are the symptoms, treatment methods, and solutions to prevent contracting the coronavirus. Let's go! Coronavirus, or SARS, acute respiratory syndrome coronavirus 2, or also called COVID-19, is a virus that attacks the respiratory system, causes mild disturbance in the respiratory system, severe lung infection, and can cause death. This virus can be transmitted from human to human. This virus easily attacks the elderly and someone who has low immunity, but does not rule out the possibility of attacking children, adults, and pregnant women. This virus originated from Wuhan City in China, and the virus is easily transmitted to other countries. Almost all countries are affected by the pandemic virus. In Indonesia, COVID-19 began to be discovered around the beginning of March, and until now, there is still transmission. Physical distancing has been carried out in Indonesia, and there are already parts of Indonesia that have implemented lockdown. This virus is easily transmitted to others by passing droplets of someone infected with the coronavirus, often holding the face area without washing hands. Contact with COVID-19 patient due to flu-like symptoms, for example, headaches, colds, cough, sore throat, etc. But there are differences in people with COVID-19, such as fever or body temperature over 38 degrees Celsius, coughing and shortness of breath. The symptoms of COVID-19 generally appear within 2 days, 2 weeks after the patient is exposed to the coronavirus. Coronavirus infection occurs in the tissues and channels of the lungs that cause inflammation the lungs and respiratory tract, making breathing more difficult. Then it can develop into pneumonia until organ failure. How to avoid this virus, or how to break the chain of transmission of COVID-19 is by wash hands 7 steps for 20 seconds. Washing hands is an action that is useful for cleaning dirt, virus, and bacteria in the hand. As one of the most contaminated body parts, the hands must always be kept clean. Although it looks simple, but the role of hand washing is very rare in preventing the transmission of various dangerous diseases. COVID-19 virus can be anywhere, stuck to objects that are around us. The most effective way to prevent transmission of the virus is to wash your hands frequently using running water and soap. Transmissions occur through objects around us that are contaminated with the COVID-19 virus that we touch and then touch the mouth, nose, and eyes. So the transmission is very effective. The right time to wash hands is before and after eating, after using a public toilet, and do not touch the face area, especially is in the eyes, nose, and mouth. If not washing hands, because these organs can be the entrance of germs or virus that cause disease from the body. Okay, open the water, tap with your elbows, then pour enough hand washing soap and add a little water. 1. Rub the palms in a circular motion. 2. Rub the right palm over the back of the left hand with finger crossed back and forth. 3. Both palms facing each other and finger crossed. Rub between the base of the finger from the inside out. 4. Finger lock the inner side of the right hand of both hands and vice versa. 5. Thumb and right palm holding the thumb of the left hand, rub between the thumb and index finger of the left in a twist and vice versa. 6. Rub your fingertips together in the left hand and vice versa. 7. Wash your hands with soap 40 to 60 seconds. After that, always wear a mask when outside. Masks are personal protective equipment used to filter the air that enters the respiratory system. Masks are also used to prevent transmission of infectious disease through the air or droplet. At this time, it is very important to use a mask because the coronavirus can be transmitted through droplets, and this is often invisible to human eye. When a person coughs or sneezes, a droplet that unconsciously can cause infection and secrete a virus can become a pathogen if someone does not have a good immunity system. Initially, the World Health Organization (WHO) did not recommend using masks if we're not sick or did not work in places with high potential for disease exposure. However, recent research on the development of the coronavirus or COVID-19 states that there are concerns that groups are unwittingly prone to spreading the coronavirus. The group called asymptomatic and pre-symptomatic are people who have been corona positive but have not shown any symptom. Therefore, people are encouraged to wear cloth masks and medical masks that can still be used for medical teams who treat positive COVID-19 patients. because the medical team is at high risk for contracting the coronavirus. After that, doing physical distancing. Do not touch the face area. Not leave the house if there is no urgent situation. Consumption of vitamin and do not panic. COVID-19 treatment can be done by means if the illness is severe. So go to the government referral hospital where the patient will perform treatments that are monitored by doctors and quarantined. COVID-19 infection can be confirmed by rapid test, swab test or PCR, polymerase chain reaction, test to detect coronavirus in sputum, and CT scan or chest X-ray to detect infiltrates or fluid in the lungs. Okay, that's all. Thank you. I hope the coronavirus will soon pass and Indonesia will recover. Okay, bye.